Think about the last time a medication didn't work the way it was supposed to. Maybe it took months to figure that out. Maybe there were side effects nobody warned you about. Maybe you switched doses, switched drugs, or even started over more than once. That process has a name in healthcare. It's called trial and error. And for most people, it's just accepted as normal. Today's episode is about why it doesn't have to be. You're listening to Health Over Wealth in the U.S., the podcast that helps Americans find cash-based, client-centered care outside of the traditional insurance system. Health Over Wealth in the U.S. is produced by the Centered Care Directory for educational purposes only, not medical or financial advice. Always consult a qualified healthcare professional for your specific situation. This episode comes from Chad Stencel, a nurse practitioner at True North Medical Care in Edina, Minnesota. Chad wrote this article in Health Over Wealth about a type of genetic testing called pharmacogenomics, or PGX. The short version is this. There's a test that can show how a person's body is likely to metabolize, process, and respond to certain medications before they even take them. And Chad didn't just start offering this test to patients. He took it himself. What he found changed his own medical record and potentially his life. We'll get into that later in the episode. What does the test actually do? So, what does pharmacogenomic testing actually show? There's 3 things specifically. How quickly or slowly the body will process a medication, whether a standard dose is likely to be too much, too little, or right for a specific person, and what side effects are more likely based on the person's biology. This isn't experimental. It's backed by decades of research and peer-reviewed clinical guidelines from an organization called CPIC, the Clinical Pharmacogenetics Implementation Consortium. That was a lot to say. These guidelines are used by health systems and clinicians across the country. And this test isn't only for people starting a new medication. Chad makes a point of saying if a medication isn't working the way it should, this test can help explain why. That's a question a lot of people are living with right now and don't know there's an answer for it. Here's where it gets personal. Chad took the test himself. His results showed he's a poor metabolizer for Plavix. Plavix is one of the most commonly prescribed blood thinners in the United States. It's used to prevent dangerous blood clots. For Chad, based on his genetics, that medication wouldn't work the way it's supposed to. In an emergency situation, a heart event, a clotting risk, that is not something anyone wants to find out after the fact. That information is now on his medical record. So if he ever needs a blood thinner in an emergency, providers know immediately to reach for an alternative. That's what this test does at its best. Not just better prescribing for routine care, but protection in moments where the wrong medication could be the difference between a good outcome and a bad one. Chad Stencel, nurse practitioner, True North, he gave permission to share his story and shares it in the article he wrote in Health Over Wealth in the United States. What does this mean for everyday care? Chad practices outside the traditional insurance model at True North Medical Care. That matters here because this kind of testing and this kind of conversation takes time. In a standard insurance-based appointment, there often isn't room to go deeper than the presenting symptom. Cash-based practitioners like Chad have structured their practices differently. Results like these get interpreted alongside a patient's full medical history, current medications, and overall big picture. Not filed away, actually used. If this is the kind of care that interests you, practitioners who have time to use tools like this the way they're meant to be used, they're searchable by location and specialty right now at how.healthcare. And one more thing before you go. If you're currently taking medications, especially blood thinners, antidepressants, or anything you've had to adjust more than once, pharmacogenomic testing is worth asking about. Not as a guarantee, not as a replacement for your provider's judgment, as one more piece of information that can make your care more precise and more personal. Chad teaches a course on pharmacogenomics for practitioners who want to learn how to implement this in their own practice. You can find the link to this in the show notes. If this episode was useful, new episodes are added regularly as practitioners across the country share what's working in their practices and what patients need to know. Subscribe at how.healthcare and you'll be notified when new episodes are released.